Hello, good evening. Today, I want to talk to you about functional medicine. I want to explain the realities of functional medicine. I want to explain what it is, and I want to see how it can be something that might be useful for yourself. So first of all, functional medicine is a clinical model that develops that uses new and exciting tools that most doctors are around the modern world use, and they're able to use this to look for root causes of illnesses. So that that there is pretty powerful in the sense that when a lot of these medical tools are used, they're not always looking for the root cause, and that's a big problem because therein lies the philosophy of natural medicine. Natural medicine or functional medicine. Functional medicine and natural medicine are very similar. The biggest difference between those two is that functional medicine tends to use more cutting edge tools that more licensed physicians are able to use. Um, Regular natural medicine can go into a lot of the things that you don't need, typically don't need a lot of licensing or education. With functional medicine, you can typically are done by licensed physicians who can get, who can utilize a lot of these modern tools. So some of the modern tools that I'm referring to about is one is blood tests from typical, blood laboratories, or they not only do blood lab, they also do things like urine analysis and things like that. But these types of labs, for example, some of them are Quest Labs and LabCorp. They, they're able to use modern equipment to analyze blood. The other type of tools that functional medicine uses is hair analysis. In hair analysis, there's a way of looking for toxicities or toxic minerals and things like that that might be in your body. Typically, these minerals work their way out onto the skin, and the body is able to use these minerals and get rid of them in the hair. Hair is part of our skin, and skin is one of our detoxifying organs. So it's a really good place to start looking for these types of toxicities. Another type of tool that is used is radiography. Radiography, you're looking at X-ray, you're looking at MRI, you're looking at CT scans, you're looking at DEXA scans for bone mineral density. A lot of different types of sonograms are used. It all depends what you need. In functional medicine, it kind of opens up the field to using a lot of different types of therapies again, or sometimes natural medicine. And there are a lot of good regular natural medicine practitioners out there. But again, they don't really have their hands to get into a lot of tools. So Harmony Clinic, we definitely use these methods for analyzing a person. But the biggest difference between modern medicine and functional medicine is that we are looking for root cause. When you look at the root cause, you're basically working with the body. And when you work with the body, it's a big difference, big philosophy change, because this type of medicine will work with your natural body's ability to heal itself. And that's who is ultimately doing the healing. It's the body. The body is capable of a lot of these things. So, and that's what we do. We basically find out what's going on, find out if there's any nutritional deficiencies or mechanical deficiencies, or we look for the root cause, and we try to help the body help itself, because the body really wants to heal itself. It really, really wants to. If it didn't, we wouldn't be alive. I mean, life is so difficult to keep going against the grain if the body didn't want to live, it just wouldn't. Yeah, once it is made, it has functions within itself to keep going. And then when you have the mind-body connection, if the mind decides that no longer wants to live, it may take a long time, a few years to develop that. It all depends how good the person has, how good of a connection between mind and body the person has. But ultimately, if the body is designed to want to live. Now, what type of therapies can you expect from a functional medicine provider? You're looking at vitamin and mineral supplementation. The reason why this is key is because our foods are what is what the body uses to heal itself. And in food, see, in nature there was a cool little relationship between the animals and their food. Typically, animals trusted nature to have all the medicines that they needed within the food. So, it's kind of like it was a good relationship. Modernization came in, and they started messing with the soils and things like that. They started adding, really mainly taking away and then adding some back, and it really messed up that relationship that we have with food way before, probably a couple hundred years ago. In fact, it might have started way before then. But we typically do supplement with vitamins and minerals, mainly because, again, we're working with the body, and the body expects these natural vitamins and minerals to be in the food. So we have to provide that food, provide that back. When you separate vitamins and minerals, you start getting into a little more medicine. So so you can do high dosages of vitamins or high dosages of minerals to get certain things going in the body. And this is where a practitioner, spends his years studying what vitamins do what single minerals do what. Typically, nature doesn't single out vitamins and minerals, but when you're using it as medicine, sometimes you do this for a short while until the body's able to prime the pumps again, and those healing capabilities start working again. And then typically you're weaned off of the high dosage vitamins and minerals, and you are put on a more of a general food-based vitamin and mineral supplementation, which I personally recommend most people be on because it's so lacking in the food. Remember, never forget that the body expects these things to be in the food with every meal. Every meal that is supposed to be there. If you miss by one meal, if you just get the calories, you don't get the vitamins, then you're looking at deficiencies. So the body starts going into the bank accounts, which is typically reserves in your bone minerals and things like that. And you start developing things like osteoporosis or osteopenia. So that's that. The other thing that a functional medicine provider will work with is diet and lifestyle counseling. Those are very important, very, very important. The diet, because again, what I mentioned previously, and the lifestyle counseling is because the mind is very, very powerful. The rest of the body is basically doing all its functions, living as your mind wants to live. So the mind is in charge of the body. We're composed of trillions of cells, and the mind is the one that is telling all these trillions of cells what to do. The mind tells the hands what to do. The mind tells the elbows, the shoulders, the hips, the knees, the feet. It tells what to do internally, our digestive system, our cardiopulmonary system, our endocrine system. It's all working according to how the mind sees its reality, and it's doing its best to adapt to its reality. So it's a really fascinating relationship between mind and body. So we typically, a functional medicine practitioner typically advises a person to be aware of that. it's very, very powerful. Another form of therapy is herbal medicine. Herbal medicines were made, by the creator to heal, and it's the first medicine. It's not so much in the food realm because it has phytonutrients in there, molecules, compounds that are typically not so much calorie rich, but they're a little more in the realm of medicine because they get to move things in the body where typical food wouldn't. So herbal medicine is very, very powerful, and it has to be used judiciously, because as we know, a lot of herbs out there can do a lot of harm. So, you're looking at some more than others. Some are very mild, things like chamomile and herbs like that. They have a very soothing, very mild sedative effect on the nervous system. But there are other things like the one that Hippocrates. I'm not sure if it was Hippocrates that was forced to, not Hippocrates. I'm sorry. Another famous philosopher was forced to drink, nightshade, I think it was, or in the nightshade family, and which was basically poisonous. So a lot of careful handling has to be done with the herbals. Not to scare anybody, because the amount of herbs that are that powerful are not that easy to access, but some of them are. So you have to be very careful. Just don't be afraid of herbal medicine, because a good licensed professional should know how to handle most herbs. Homeopathic medicine, that is a very powerful way of healing, and it's done on a totally different level. It's done at a physical, at a physics level. Herbal medicine, a lot of it is done on the chemical level, the molecule level, but homeopathic can go a little bit beyond that. And with that being said, at the same time, it's very mild. A lot of its side effects are almost minimal. Herbal side effects are at their minimum. Vitamin mineral supplementation, their side effects are minimal. So, I'm not saying that there isn't, but with homeopathic, their side effects are probably one of the least. But it is a powerful form of medicine. I mean, you take arnica after some kind of injury, whether it be a fall, a bruise, an auto accident, a surgery, and it has been widely known and documented that people will heal faster and their pain levels are a lot less. So it's very, very powerful. Chiropractic medicine, that's another tool that a functional medicine provider will do if the functional medicine provider has been trained as a chiropractor. DOs can also manipulate or adjust. Also, naturopaths are able to manipulate and adjust. Just chiropractors are the ones that do it the most, and it is a technique that needs a lot of work and a lot of years go into learning different techniques. So those aren't the only treatments that are available, but those are the basic core of treatments available. Now, what kind of diseases do the functional medicine providers take on? What kind of patients? In reality, we're not looking for diseases. We're looking to make a person function better, and therefore their own bodies will heal themselves. So most diseases can probably be helped through functional medicine. With that said, there are diseases that are easier to treat than others. But it's basically we're treating the person. We're not treating their disease. We're not trying to manage their disease. If they do have some symptoms that we can manage, well, therefore we definitely do that. Sometimes the symptoms are very strong. So there are medical doctors that have strong medicine that we work with. But these are the medical doctors that we work with here at Harmony Clinic are medical doctors that are trained, highly trained in herbal medicine and other natural medicines. So you're not left alone with these strong symptoms that could be debilitating and very painful, and basically just put your life on hold. So if this is something that's been helpful to you, and learning more about functional medicine, well then that is exactly what we're trying to do here at Harmony Clinic. We're trying to educate the people, educate the public on what's out there for them to help heal them in a way that the root cause can be helped and their lives can be improved.